So first of all, I would like to ask you if you give me your permission to put this video for education on internet for other people's benefit.
Yes, that's fine.
Excellent. Now, tell me, you had back pain for a long time in your chest area, is that correct?
Yes.
For how long did you have that pain?
Years.
Years. And I understand even they put a spinal cord stimulation device there because nothing else worked.
Right.
Did the stimulation device help you?
No.
And then you and we met a few about early months of this year, correct?
Correct.
And then we tried few other things, and then we decided that all of that is not working.
Right.
And we did a discogram.
Right.
Is that correct?
Yep.
And discogram showed us that two of your discs, the in T8, 9 and 9, 10, actually are source where your pain is coming from. Now, when did we do the surgery?
February 12th.
Which is about 2 months ago.
Right.
And after the surgery, when did you start walking?
I think it was up later that day.
Excellent. And I understand that you left the hospital just 2 days later or so, or?
I had surgery Thursday. I went to rehab Sunday.
Okay.
I left for home on the 17th.
Excellent.
And I went by train.
Excellent. Excellent. Wow, that's a long way home.
Yep.
Now, tell me, how long did it take you to go back to your work?
5 weeks.
5 weeks. Excellent. And your pain?
And I would have probably went back and forth, but there was paperwork.
Okay, I see. Now, your pain before the surgery, 1 to 10, how bad was it?
It would be up to 10.
Okay. How bad is it now?
Probably 2, and that's probably because I'm overdoing it at work.
Okay. Now, I would like to show your picture from your incision. Are you okay with that?
Yep.
Me showing that?
That's fine.
So this is the picture of the incision of your back. And as you see here, this is actually the longest incision is where we took the stimulation device out. So the stimulation device is out, it wasn't working for you. And we put 2 spacers in those spaces we talked about. Through this incision, we used the small incision here on the side to do the screws, and then the upper for putting the rod in. This is just 2 months after the surgery. With time, they fade and they are barely visible. As well as, most importantly, it's what's happened under the skin is the important thing, that we don't have to cut the muscle, we didn't have to cut the rib. In a regular surgery, the incision on the side of the chest would have been from here, going from here, all the way turning and going back there. Many surgeons reject the rib even to get there, to just put what we achieved with this incision here. Then if we would do the back surgery open, the incision would have been in the middle from here to here. But as well, we had to separate the muscle from the bone, and that's actually what puts it back up the recovery much longer. If you're okay with that, I'd like as well to show the x-rays of what we achieved. Are you
Yep.
okay with that?
That's fine.
Very good. Then let me just get the x-rays that shows, first of all, that here is before the surgery. We see the stimulator device here, which is removed. Now on the side view, we see the screws. The spacer that we put in is practically plastic, so it's harder to see, but here you see 2 pins that are metal inside of the spacer that shows where the spacer is located. They are in a good position. Now I like to show the other view, the front view. This is the front view, and again, here you see the stimulation device that it's removed. And here you see the screws that are going in, and they are connected with a rod between. Overall, you think the surgery helped you?
Yes.
Excellent,
Yeah.
excellent. So I'm